Hello, everybody. I'm coming back to you this week without a patient again, so I'm just gonna do my eye and ear assessment, and I'm just gonna do it and kind of do it on myself. Um, yeah. All right. So let's get started with the let's start off with the eyes. So first off, you want to inspect the eyes. You want to inspect the parts of the eyes. You want to do the eyelids, the eyelashes, inspect the cornea, inspect the like the retina color and the iris. Not the retina, the iris, pupillary constriction, all that stuff. You want to do the sclera, cornea, missing one, lacrimal apparatus, which is this little guy right here to secrete tears. Um, and you want to make sure that there's no abnormalities with how it's structured compared to every other normal person's, and that it's able to do its job, which is say for the pupil let in light, say for the iris, provide the color of the eye, or the cornea, provide the structure that protects the eye, especially for like the pupil. You want to make sure that it's allowing light in and that it's not being obstructed, because that could be detrimental to your vision. It can cause sensory deprivation, and you want to make sure that everything's just normal. Look at their eyes. Tell me what you see, because if something's wrong, if the iris is discolored, that could show signs maybe dehydration, maybe some kidney problems. I'm pretty sure I saw. Don't don't quote me on that, but I think it's true. All right, so if I'm going to be doing my assessment first, I'm going to start off by testing the visual acuity. So I'm going to look at something like at a decent distance. Like let's say for example, I'm going to look at uh my my textbook for ATI that we got. Be looking at it, making sure that I can read it, and I can read it. It's right there. Next up, I'm going to be doing a cranial nerve test. So the cranial nerves that are usually involved in the movement of the eyes and how the eyes function. You got the optic, ocular motor. You got the abducens, the trochlear. Um, oh, that was all right. Okay. So be making sure you test the eye movements, lateral, for the abducens, downward and inward for the trochlear, and then pupillary constriction, and uh, and the and the movement of the eyelids for the ocular motor. And then optic is just basic sight. So that's kind of, you just test right off the bat. If they could see you, they'll make it notice that they could see you, and then if they can't see you, they'll make it clear by squinting. Kind of like the external factors that can play a role in seeing if somebody has sensory deprivation from their eyes. And next, I'll be doing the cover test. So first, I'm gonna cover my one eye. I'm gonna take my, and then I'm gonna stare out, open up both eyes, make sure that nothing's closed, take it off, and make sure that both eyes are straight. That was right, right? Yep. Okay, and the corneal light reflex. So first, I will grab the pen light. You can't really see it, but my pupils are constricting. Let's see if this can work. Ow. Ow. All right. Next is accommodation. So I'm gonna grab let's say I use the pen light again, hold it in front of me like this. Look from, follow it left to right. And then next will be the consensual and central response. So I'm looking over at my lamp right now. You can't see it, and it's not gonna get any darker in my room, unfortunately. So this is what we got to deal with. So I'm looking at my lamp. I got my pen light there, and my pupils should be constricting. Okay, now the next part of the assessment is the ophthalmoscope, which is with the right hand, the right eye, and the right eye. But since I can't use an ophthalmoscope because I don't have one, I'm going to show you a picture on my computer of an eye that I found, and I'm gonna kind of talk about it a little bit. So, looking at an eye and you use an ophthalmoscope, you really want to get really close. I went to the eye doctors at the start of the semester because I was having some eye problems, and they looked into my eye from this part, through the pupil, and the eye doctor, she was inspecting stuff as the optic nerve, the fovea centralis and the optic disc, conjunctiva, retina, all that. So she looked at it, and this is the best picture I can find for an eye. There's not really any in-depth. There's a picture of a girl right here, but that's just thyroid disease. We're not talking about thyroid. But she looked at the inner portions of my eyes, and this is what it kind of looks like. In the back here, you'll have the optic disc, which is the blind spot, because the optic nerve, because the muscles and the nerves overlap, so it has no sight. And then you got the retina, the outer layer. You got the what else is on here? You got the macula, which is back there, and got cornea, lens, pupil, all the pretty much like the basic stuff. We got the iris again, as I said. If it must be white, it has to be white. If it's not white, it's indicative of other health issues. I kind of forget what they are right now, but that's pretty much the anatomy of the eye. That's what you would use for the ophthalmoscope. Right hand, right eye, right eye. I forgot to mention when looking at a newspaper, that tests for your optic nerve, and then you use the Snellen chart. Use classic. See those in a doctor's office. Usually you could be able to read everything. 20/20 vision. 20/20. It represents. I don't know. I forget what it represents. I'm still studying for the test next week, but I have the flashcard, so I'll know by next Thursday. But I thought I just mentioned that. I forgot to mention that earlier in the video. All right, for the next part of this video, I'm going to be doing my ear assessment. So first off, when you want to inspect the ear, you want to use an otoscope. That's the instrument that they use to inspect the inner portions of the ear. But there's also stuff on the external part that you could see. There's there's like the auricle. There's the ear canal. There's a tympanic membrane. There's all that stuff. You pretty much want to inspect the outer portion of the ear. I know that a lot of boxers and a lot of people who fight in the UFC, they have really inflamed ears because they get their head pushed onto the mat so much. That's one thing I noticed with people who are into that type of sport, and that could cause hearing obstruction possibly. But pretty much when you want to inspect the ear, you want to check for the size, the shape, the skin condition. You want to inspect the auricular, the earlobe, the cochlea, the top, the helix, and then you want to inspect the inner portions, the ear canal to the tympanic membrane. Yeah. For this, I know what's going on with the ears because I've had ear problems before. I had this condition called Surfri's ear, and that's where there's a bone growing out of your like your skull that kind of pops into your ear canal, and I still have like the remnants of the surgery that I had. I had a surgery that had it removed, but it really interfered with my hearing for a certain amount of time because when there's a thing growing in your ear canal and it's blocking it, and then there's also wax on it, and you can't get the wax because of like the osteoma coming out of your ear. It makes hearing a lot harder. So that's one thing I've learned with the ear. And then you want to use the otoscope. You want to inspect all the inner portions. And I'm going to talk about that because I have a picture I want to show you guys. Ooh, okay. I know the flash is on. Now for the inner portion of the ear, you want to inspect the tympanic membrane primarily, along with the ear canal, because the tympanic membrane, believe it or not, connects a lot of the parts of your ear together. It connects the nose, the throat, and the ear, because there's the eustachian tubes that go down from your ear to your nose, and then your nose takes stuff up and it goes down your throat. So that's why they have the ENT doctor. But I'm gonna show you what on my computer what I found, the picture that I saw that is really good picture of like of ear anatomy, pretty much, that like help me explain what I'm trying to talk about. All right, so you got ear canal. When I had my osteoma, came out about right here, blocked off my hearing, so I could not hear a thing. It blocked off my vestibular cochlear nerve. Oh, and from there it goes to the eustachian tubes down to about your nose, and then once it goes to your nose, it goes down to your throat. So when you inspect the tympanic membrane, you want to inspect it for the color. Should be a nice pink color. There should be a cone of light on it, and then you also want to inspect the integrity of it, because if you have a ruptured tympanic membrane, you'll have hearing problems, and you'll have a lot of stuff going on. Yeah, so that's pretty much the anatomy of the ear. You got the outside. You want to inspect the size, shape, skin condition, the angle of the attachment. It's not coming off weirdly. Check for any lesions, any skin lesions. Check for inflammation. You might see that with the boxers or the UFC fighters I was talking about. The pinna tragus and mastoid process. A mastoid process is that little thingy coming like in the middle of the ear. You can't see in this picture. And then you want to do the otoscope exam. Do tympanic membrane right here, cone of light, the color, the integrity of it, and then next you'll be getting to your hearing test. The last part of the ear exam, you want to do the test. You want to do the Weber test, the Rennie test, and you want to do like the Romber, the Whisper, and you want to check out for the cranial nerve, for the acoustic. So for the Weber test, I know that it tests for conductive or sensorineural hearing loss, and that's pretty much to see how bad your hearing is or why it's happening. So for the Weber test, if you have conductive hearing loss, you should be able to hear it in the better, I think, in the worse ear. And then for sensorineural, I'm pretty sure you hear it in the better ear. I think that's right. I was right. If you have conductive hearing loss with the Weber test, you'll be hearing it in your bad ear. But if you hear it in your good ear, that's sensorineural. And conductive hearing losses, they're mainly from a couple of reasons. You could have a bad eardrum. That's why you do the otoscope exam. It could be from infection. You could have an ear infection. Could be from just a buildup of earwax in your ear. A lot of stuff. Then for sensorineural, it's usually because of aging. You have maybe you grow up in a loud and noisy environment. I know I do, living with 3 women in my house. You could have head trauma from maybe playing contact sports or having concussions and whatnot. A lot goes into it. And then for the Rennie test, I know it compares the air conduction in your ear to the bone conduction. And there's a lot of responses. The Rennie test, the AC would be better than the BC. And if it's conducting, the BC is greater than the AC. So I don't really know what that means, kind of. I'm going to watch the videos that my classmates put up with the Rennie test because I don't know how it's conducted because I did not look into it that much yet. But I'm going to say that that's normal assessment. So for Weber test, you want to just like talk to somebody, or sound heard bilaterally equally. Okay, you want to just talk to somebody. Say repeat 3 words. See if they can repeat that to you. That all that tests like your cranial nerve too, your acoustic, and then you want to do the Romberg test where you stand up, stand still, and that's hearing in equilibrium. So Romberg test where you stand still, feet together, arms at the side, and that's for balance. And that's all that I could really think of. And then you got the cranial nerve 5, the hearing equilibrium, sensory. Yeah, because your acoustic also helps out with your equilibrium, which is controlled by your cerebellum in your brain. So it all makes sense. So that's kind of my assessment video. I didn't do too good of a job today. Don't have a patient. Wish I did, but roll with the punches.